we will now open the floor for questions. We'll take first 4 questions, and then if there's more time after the presenters have had a chance to answer, we'll do another round. Please put your hands up and the mics will come to you if you have a question.
Hi, this is for Ursula. What would you do differently if you could do it again? That's a really fascinating method. And also, what was the interaction like when the girls were sharing their photographs and deciding which ones represented the themes? Just what was the kind of the mood in the room and stuff? Thanks.
I have 2 questions. One regarding the SPSS. What was that? NSSO data set you have used for fruits and vegetable consumption, but it is the purchase capacity, is what I think. And is there a bias in the food consumption of fruits and vegetables with regards to scheduled tribes who live in the rural areas with a lot of kitchen gardens and their own farming where they could consume fruits and vegetables? I mean, why would it be only why would only fruits and vegetables be lower? It could also be fish, it could also be meat, it could also be milk. Why just give one advice on fruits and vegetables? The second question is to Archana. I was thinking why, you said that the age group is 5 to 10 years, the mothers, so why not 0 to 5 years? Because when you talk about dietary diversity, it's the first 5 years. The government wants to see the dietary diversity improvement in the first 5 years, where the maximum undernutrition is, and why we have chosen 5 to 10 years.
So there are 2 more hands up in front.
Hi, my question is to you. How did you categorize between local, and sorry if I missed it, between local, national, and global? Because I feel like it would be incredibly difficult because nothing's local, nor is anything purely global. Mostly, like increasingly, local foods are influenced by global ingredients, and global kind of foods get adapted into local environments through local businesses and so on. So how did you go about empirically making your categorization?
Hi, mine is also for Solvig. I was curious why you limited it to 3 food groups or 3 items, and why did you have the option, or why did you choose not to give them a large variety and have them place them in whether they felt they were local, kind of along the lines of his question, local, national, or global? And I want to ask the same question that Ashley asked of Ursula. Is there something you'd do differently if you did it again? I'm fascinated.
So Ursula, do you want to start?
Thank you. So one thing that we would do differently, and we have done differently because we've just done a second study, was not to use phones because it was very complicated. Every student had a different phone. The quality was very different. So we had a bit more money and actually purchased cameras. But there's different problems coming with cameras. We had 2 stolen, 1 broken. So these things to consider. Of course, the quality is better, but there's different considerations in terms of camera versus phone. And then another problem that was related to the research questions, that they were not very clear. It was very difficult, this concept, to answer a question with a photograph. So we should have spent more time on that. We spent a lot of time on ethics and safety because we were very concerned about that. But we should have spent instead more time on explaining the research question, having more sessions with the students on that. And then you were asking about the atmosphere. Honestly, it's very difficult to do studies in urban areas to gather people together. Everybody's very busy. The students have commitments on the weekend. They have to work in the home. So there was a lot of concerns that they would even come. And we, because we did it for the first time, were running late with the time. They stayed late and they were so excited to do all this. And it was very interactive and exciting. So it was actually a very good sign that despite all the commitments on weekends, that they stayed late on all these occasions where we met them.
Thank you for your question. So in this paper, we use the NSSO, which has the consumption quantities of fruit and fresh fruits and vegetables. So that's the focus of this paper, that we want to turn attention on the important topic of fruit and veg intake, and where we have seen in the NSSO that the consumption is much lower than the WHO benchmark of 400 grams per person per day. And we include scheduled tribes as a binary variable in the regression, and we measure that against a baseline of other forward casts, because along with other sociodemographic indicators that are hypothesized to influence fruit and vegetable consumption. And basically, one of the key findings of this paper is that we can see there is a caste-based inequality in fruit and veg consumption. So this is basically, that's the highlight of this paper. Thank you.
Thank you for the question, sir. Firstly, as you know that for 1 to 5 year old children, there is already a supplementary nutrition program being conducted by ICTS, by Government of India. So there was no purpose on working on the same population again, because along with the SNP, nutrition education is also being given to the mothers. And second thing is, as I already told, this is a part of the nutrition communication intervention project. The aim of the project was to increase the diversity at the household level, but keeping child as an index. Here, not only we are targeting the 6 to 10-year-old children, but the family as a whole. So that was the purpose of selecting, and the studies on 6 to 10-year-old children are very less limited across the global and also in the Indian. So they are consuming 3 major meals at home. So they are majorly dependent on the mothers, and the diversity of these children are more when compared to 1 to 5-year-old children. So the focus was, this was the reason for focusing them. Thank you.
So Vivek, do you want to?
Thanks very much for the question. So first about the categories. So the categories is something that we created a priori based on our previous work. So since 2012, we've been in the study area, and we've talked with adolescents, we've talked with grandmothers, we've talked with physicians, and then we also have our study team that's based there. The idea that we were trying to get at as we were setting this up is largely defining in our minds the categories based on 2 criteria. One is sort of a generational appearance of an item. So something traditional was something that your granny would have eaten when she was a child. Something national is something that's probably been around since your parents were young, but maybe not from granny's time. And then something global is something that would have come up in the past couple of years. So one is, how long has there been a presence? Because clearly there are things like those biscuits that you get with tea that have probably been here since the English, and they're not really local, but they're sort of local. The other component is around where it's grown, because we have another component that we're interested in, which relates to local farmers versus other sources of food. So the other component was about whether a food is grown close by, or whether it's something that's brought in either from other parts of India or from outside. So those were the categories that we were working with. And as you asked me, what are the things that I might do differently? Well, I think we did those well. This was actually a pilot study, so we shifted some things around after this. But I think if I had discussions with many other people in this room, or we might come to different conclusions, at least about some of the items. Are they really local or global? So within our team, we had those discussions and debates and compromised wherever we thought was the best spot. But just to be clear on that, our respondents didn't know about this categorization. We didn't tell them we think that this is local, we just showed them 3 pictures. And we went with 3 pictures because we wanted to get at how people are making trade-off. So is it the case that if I wanted something that felt really clean, or that was kind of expensive but I couldn't afford, would I be interested in shifting just to try something else, to try something new? That's what we were trying to get at, and we thought that more than 3 would probably be hard for people to wrap their mind around seeing more of those at once. So, but I think that the point that you raise that's really excellent is that having these cards, we can also go, for example, into a pile sorting direction. So we have all the pictures, and then we can start talking with people, and perhaps even back out. Do they agree with what our previous respondents thought and what we thought about what's local, national, etc.? I think that's in terms of what we do differently. Yeah, I think I mentioned that categorization is something that will probably keep coming back to again and again. It was the other component that I'd, as somebody interested in survey methodology, that I think is really interesting would be to try to systematically capture the discussions around these cards. People actually loved answering the survey because it's not your typical paper survey. So, and everybody comes and looks, and everybody wants to chime in and tell, you should choose this one, this one's good. And this is something that happens in data collection a lot, and I think we ignore it more than we should. So systematically tracking how people are interacting with each other, I think would be really useful.
So we do have time for 2 more questions, 2 burning questions. Okay, so those 2.
This is for Celine. Good work on the optimization. So there are 3 questions. One is, did you test any of those food-based recommendations? Are they realistic, feasible? And what are the cost implications of your optimized diet? And the third one is about the problem nutrients. So if you cannot optimize them based on the local foods, so according to you, what would be the best strategy to overcome those?
Hi, my question's also for Celine. Really interesting to see this work. We also used OptiFood in Turkana a while ago and had very similar results. So it was really great to see that there's a lot of similarities there. Really similar questions, but I'm really curious to hear whether you're going to be using or applying the recommendations now and how you'd possibly do that in such a food insecure area.
Okay, thank you for these very interesting questions. I'll maybe start with the cost implications. Here with the OptiFood tool, we didn't use the cost option, but I've already mentioned probably the recommendations for meats, flesh, eggs, and as well as dairy wouldn't really be very realistic in that setting. What we have done is we have, for the same population, we use the cost of diet tool, which is slightly different. It looks more at the cost. And we used that tool in a slightly different way also. Like we modeled the cost, the minimum cost of a nutritious diet without wild foods and with 5 selected wild foods that were rich in certain nutrients. Because as I already said, there was 40 foods that occurred in the diet, but we documented in ethnobotanical studies, we documented over 100 foods. And so let me first get back to the results of the cost of diet. So we modeled that and we saw that the diet was unaffordable for even the richest of the 5 quintiles of households, still unaffordable. Even when we entered the 5 wild foods that were particularly rich in certain nutrients, the cost would reduce by up till 70%, but would still be unaffordable for most of the households in the area. So this clearly already points to your third questions that we need other strategies to complement. Curiously, we did the modeling in cost of diet also. For example, Save the Children is distributing micronutrient sprinkles, but we modeled them the way they are distributed. So they are supposed to be given 1 sachet per day per child. But actually the households only get 3 to 4 sachets per week. And they often have more than 1 child. So if we modeled that also, there was basically no effect of those sprinkles on the cost of the diet. So you would be better off promoting some wild foods. Of course, you have other limitations there. I don't want to enter that way. So it's very interesting to put the results of all these different tools together, and we get a lot of insights about that. We have not gotten to the point of testing these food-based recommendations out, but we do have a new project that is starting in the area now on the 1st of July, and we want to actually implement a community-based approach whereby we actually take back all these results to the communities. We really sit down, we take our town, even 6 months, we take them through a number of workshops to discuss all these results, and then to figure out what can we do here as a community. And we also work with the ag extension workers, the community health workers. It's a really integrated approach. The NGOs, they are all part of the approach in order to figure out what would now be the best strategy. And we might still not have the best diets out of that. But from experience in Western Kenya, where we have developed and we have a proof of concept of that approach, we saw that dietary diversity, for example, increased for women from about 30-something% of women meeting dietary diversity up till 80%. And there's also work to be done still on that side, because we were very surprised about that result. How come? And I think one of the issues is that it was really bottom-up. We did not decide anything for the communities. We just guided them through the process. So that's one of the factors, but we are also going back to our original sites to figure out, like, what are the factors that have actually influenced that result. So we are working there, and we are going to take the approach to northern Kenya, Turkana, as well as Ethiopia, and we were going to test it further out, see how it works, why it works, in which conditions it works, if we can repeat it at all, etc.
Thank you. I believe this has been an extremely exciting discussion on food environments and drivers of food choice. Please join me, thank all our presenters for their wonderful presentations, and thank you, audience, for coming. A round of applause for them. Thank you.